Hello, my support fibromyalgia friends. What is going on? I just wanted to jump on here for a very impromptu kind of live stream. Definitely needing some support for the work that we're doing. Don't forget on Friday, tomorrow at 9:15 a.m. I will be talking about the Wahls Protocol from my perspective, like what got me started in the Wahls Protocol, what led me to get certified and continue to train in the Wahls Protocol, and then I'm going to share the 101 basics of the Wahls Protocol with all of you out there. So if you're tuning in live, just drop a comment, say hello, an emoji, like and share the content as well. I definitely am jumping on here because we're in need of fundraising, and this is always the toughest task of the community. But I want to just throw it out there and see about ideas, or if anyone has this in their strengths, to reach out to me. You can send me an email at melissa@supportfibro.org or friends@supportfibro.org. I've included the link and ways to help us fundraise for the organization. We are pushing a very big mountain for fibromyalgia and all our programs, and we really need some help in funding these programs in order to move forward and do the things that we need to do. We have some very heavy asks for the community. And funding is the way to really get it done. We are also going to be opening up some patient advisor groups, and those applications will go out shortly to invite patient advisors into the organization. And what we want to do also is try to compensate people for their time, at least for the meeting time, and then move forward into actually having them establish themselves with the organization and then move to program directors so we can really direct a lot of the programs that need to take place, and grow as much as we can, because now we're taking on a national position, which we've always wanted to do. And our intention when we got established as a nonprofit organization was to fill in the gaps for the fibromyalgia community. But those gaps are many and the gaps are large. So taking this forward, we're definitely going to need some more funding. And a big thank you to the Jaharis Foundation and Yvonne for helping us get this started, and the momentum, and all our wonderful volunteers who've been volunteering their time to get these programs lifted. It is a heavy lift. We rallying around, and anyone making those donations, it really matters. And the Facebook fundraisers really do matter a lot more than anyone would ever know. So if you can and are able to do those things, we appreciate it. We have a list. We have opened up the Seas Candy fundraising again. They call it Yum Raising, so I'm going to use that. So there are chocolates for the year-round one. Just understand shipping for when it's hot and warm is a little bit more for those, but you can get chocolates all year round. So we've opened up the store. I guess we talked to them, and now we can have a store for Seas Candies fundraising all year round until December. So that's available. They also have their summer theme. If you want more of the Seas Candies, like candy part of it, like they have jelly beans and those stars and those things. So that's also available, and it's a very good option for us for fundraising too. So if you have gifts or family members that love Seas Candies, it's a perfect opportunity to help us out. Also, Amazon Smile, we are registered. So if you do shop on Amazon, Amazon Smile is a great way for them to donate a certain amount of percentage of your purchase to the organization. We really appreciate that. eBay, if you're an eBay seller or know someone who sells on eBay, you can dedicate a portion of the sales over to the organization as well. All of this helps. Facebook, if you're on Facebook, fundraisers, birthday fundraisers make a difference more than anyone knows. One, it not only is donation proceeds to the organization, but it helps us within the algorithm of Facebook. And because all of you, we've been able to get into social impact programs with Facebook, and they've been able to help us with certain things. So we're generating that content. Some of our content can actually be more monetized. So this is where, if you are not able to give monetarily, you can really support the organization by sharing our content, especially the reels. So the reels content is very interesting because the more reels that we can create, and if people have ideas or want to share their stories in a reel, especially a Facebook reel, you can send us the video content, and we'll definitely edit together and approve it before it goes live. But that type of content being shared on Facebook is very helpful for different monetization reasons and for Facebook to take a look at us as well. We definitely need our YouTubers to sign up. There is a way to donate through the YouTube channel as well. So there's a lot of different programs that we're utilizing to create more awareness and support for the fibromyalgia community. But it's not just awareness with our organization. We want to get things done. I'm big on executing, and anyone knows me, and it's a perfect time to do this. So you've seen us on the Hill, Capitol Hill, doing virtual. So advocacy training will continue. We are establishing ourselves very much with researchers. So stay tuned for more collaborations. We have a new one coming out from Cal State Fresno looking at treatments and your response to these treatments. So please definitely support the research. When we have researches fibromyalgia, we're working with more tech companies that have integrated technology with research as well. So they're going to be a part of the system. We want to talk tech as much as we can and integrate that as part of the evolution of fibromyalgia research. Patient education is going to continue. Stay tuned for more of these educational live streams. And of course, celebrating, we are hosting a fibromyalgia, our first annual fibromyalgia conference. Accessibility and affordability is huge. So it'll be live streamed and free in the fall. We're working to get speakers organized. So if you're interested in speaking or hosting a panel or moderating a panel, please let us know. So these are all programs to launch. And of course, Project Echo, which is a heavy lift right now to get the attention of medical providers, specifically experts in fibromyalgia, to educate other medical providers and what we're going to need fundamentally when it comes to funding those programs in order to get the attention we need for medical education. There is a cost to get the CMEs available. Fortunately, it's through the University of New Mexico, and they've made it very affordable. But those types of things do add up when it comes to a nonprofit organization. And if anyone has any questions, please let me know. We really believe heavily in transparency as we grow and as we build onto where the finances go for the programs. And right now we're keeping overhead slim, so underneath 10%. So that way the rest of the 90% gets donated directly into the programs. And actually it's even more because I am the one, myself and my significant other are the ones that build the website. So we put in all the effort to do the technology on that side as well. But if you do have any questions moving forward, happy to answer. And everyone's been volunteering their time, but we do want to be able to support the community as well as we bring on other patients and advocates who have strengths in certain areas. And like I said, with the patients' advisors, we want to be able to pay for their time in order to give them feedback and some of the approach, because we want to take care of our community. It's important for us to do that. So that's why I just want to keep it open conversation, open dialogue, but we do need extra support when it comes to fundraising. It's been difficult to do fundraisers and what that looks like, especially with the pandemic and having in-person type of events. But I've been looking around and I've gotten curious at some of the other events that people host and seeing how we can implement that moving forward. I love being networked with a whole lot of community across the country, but it's interesting trying to have support locally has been a challenge for us as well. But as we grow and as we move forward, we could definitely brainstorm more ideas. So if someone has a strength in this area, please reach out because we are looking at grants. I did take a lot of grant writing courses in order to complete this. But we're always searching. And I know for grants, they have to be specific and just fine tuning it, bringing on the right consultants, patient advisors as well. So it's a development in course, but we are building and we're growing and we're going to get this done. So I appreciate all of you out there. Thank you so much for tuning in. And I see some people tuning in. Hello. Thank you for tuning in, Josephine. And I'm not sure how to pronounce your name. Is it Heba? So we really want to inspire and continue the patient education for everyone around the world. It's important that you get the updated information on fibromyalgia because I hear it sometimes in the conversation. It gets repeated and we need to update what the content is. So that's why we're really going after a lot of patient education. We've been reaching out to a lot of medical professionals to come and talk to us. Hi, Lois. I hope you got your package of books. So Lois is doing amazing work over in Michigan, and we'll have more information about her support groups because that's a big thing too. Supporting the leaders that run support groups around the country. It is important to get those resources to them. What do they need? How can we help? I love that show, by the way, New Amsterdam, where he enters and he's like, "How can I help?" So that's the philosophy we're taking. How can I help? What kind of resources do you need? I want people to know that they're not forgotten in this system, whether they're leaders on the community level, patient advocates, bloggers, vloggers. We definitely want you to feel supported in this community all around. We're going to be bringing in the medical doctors to let them know that they are also supported in a community that cares. Let's connect them back into the loving patient community we have and understand these dynamics. So as we move forward, this is going to be an important piece. But I did share that ways to donate link with you. We'll have more. And again, if you have ideas to brainstorm, please let us know, because I know some of those walks and things are heavy lifts if you're doing them in person. And we're trying to be a little bit more creative, available for everyone to get involved, patient friendly if we can. Although I do love that Top Golf idea from Social Butterflies Foundation. So that might be a fun way to do something locally. I do have a lot of friends in Arizona, so that might be a place to do it as well. But any of these brainstorming ideas, if you do have family members that love C's candies, we are doing the Yum Raiser, so please utilize that. Amazon Smile, eBay, Facebook fundraisers, YouTube fundraisers, Instagram. So every way we are applying for TikTok as a nonprofit, so that way you can fundraise through TikTok directly. So we're doing the work. Definitely need some help and support, but thank you everyone. Stay tuned. Tune in tomorrow. It is going to be live streamed on the Wahls Protocol. So if you are not able to attend at the 9:15 a.m. slot for live questions and interaction, it'll be recorded live streamed on YouTube, Facebook, and if I'm brave enough, I'll probably do Twitter. But you'll be able to find the live stream there. And we're opening up new things for health coaching. Since I am a board certified health coach, that is another type of program we're launching. Specifically, we're going to start with the Wahls Protocol. So I'm gauging your interest. If you are interested in a health coaching group with the Wahls Protocol after you see the video tomorrow, this is something that's huge because that I'm certified in the Wahls Protocol. We have an opportunity to gain access to AIM at a much affordable cost. But if you're interested in doing AIM on your own, you can. There will be links there to direct you, links to buy the book, and other ways to get involved with her seminars, which are starting in June and go again in the fall. But we want to incorporate this healthy lifestyle, lifestyle behavior changes as a health coach, give you the patient education you need, and support you all the way for sustainable lifestyle changes. It's not a fad. It's about sustainable lifestyle changes and what we can do to support you at home outside of the doctor's office. So keep posted, everyone. Thank you so much. I am Melissa Talwar. I'm the executive director of the Support Fibromyalgia Network. I'm also a board certified functional medicine coach. You will hear from me tomorrow when we go over the Wahls Protocol and so much more. Thank you. Have a great day.